Clinical depression is a health condition that can affect anyone of any age, including children.
The National Institute of Health says that more than 20 million Americans suffered an episode of depression in 2020. So Dr. Jessi Gold is here to discuss the impacts of the condition on people's mental health. She's a psychiatrist and assistant professor in the Department of Psychiatry at Washington University in the St. Louis School of Medicine. Thank you so much for joining us. So I find this really fascinating. Research shows that approximately 1/3 of stroke survivors are impacted by depression. A lot of people, when they have to deal with a serious illness, are impacted by depression. But in this case, this illness is physically affecting the organ that is responsible for our mental health.
Yeah, absolutely. I think when we think about depression, we forget that it's a brain disease first and foremost. So it's a disease of the brain, and so is the stroke. So both of them are affecting the same organ. That would be a reason why it would compound and you'd have more depression in people who have strokes. But also strokes cause mental and physical changes that can make someone depressed. If you're not able to do the things that you were doing before, if it's really frustrating, if you're in and out sick, those kind of things can really affect people too. So it has both reasons for people being depressed, both biologically and sort of psychologically because of the effects of a stroke.
Mm-hmm.
You know, it just seems like there's so many different causes or contributors to depression. What are some other links to severe depression, especially in older adults?
Yeah, for depression, we see a lot of things. We kind of think about it in three clusters. So biologic, meaning you have family history, you have genetics, you've had depression before. Those are reasons why we might think about depression biologically, psychologically. How were you raised? What kind of things in your way that you process things that occur in your life, stressors, things like that. And then socially, so stressors at work, stressors in your relationship, stressors with friendships. That's another sort of area. And all those things can make it so that we have this kind of compounding effect of depression, and all of those contribute, and it's not just one thing or the other thing or one thing more than anything else. It kind of all goes together to make depression.
You know, recently we've had some high-profile suicides connected to depression of people who are like unbelievable achievers, high achievers, and I think it became very confusing for a lot of people to determine what signs of depression are. I mean, John Fetterman, from what we could see, and obviously we're not close to him, seemed like he was adjusting quite well to life in the Capitol. Can you talk about some of the signs, obvious and maybe not so obvious, that someone may be struggling with depression?
Sure. I think you're right. There are a lot of people that are we use the word high functioning, meaning going to work and still really struggling, putting on a smile and still really struggling. But the things we think about are change in sleep, sleeping less, sleeping more, change in interest in things. So where you used to be interested in going to the movies, watching a movie, and now when you watch it, it doesn't make you happy anymore. That would be a change of interest. You used to like running, and now you're just sort of going through the motions when you do it. Some guilt or worthlessness feelings, change in energy, low energy, change in concentration, change in appetite either way, so increase or decrease, kind of like a physical slowing where you just aren't doing what you used to be doing. And then of course hopelessness and suicidal thoughts being on the more extreme end of symptoms, but some people have them daily and it would just be that they got worse. I think the things that you might notice are how long it's been going on. Everybody feels sad sometimes, right? But if you're sad for more than a day, we're talking weeks, that becomes more concerning. If you're noticing some of these symptoms are lasting or getting worse, that would be more concerning. How much it's interfering with your day-to-day life is also important. So and that doesn't just include work. So if you're not able to associate with your friends in the way that you used to, or you're getting mad in your relationships more than you used to, those tend to be earlier warning signs, because a lot of people who are quote unquote high functioning can do work sort of on autopilot, and that's not the place that it affects them first. You know what I mean?
Mm-hmm.
Yeah, Doctor, I think it's such an important conversation to have, especially when somebody as high profile as a senator brings this up and says that they need help. Mm-hmm. It's great to have this discussion. These are discussions that we haven't really had for a long time. So thank you so much for joining us. Dr. Jessi Gold, thank you.